My name is Dylan Gunn. I'm the director of the Engineering Physics Project Lab at UBC. One is making face shields. We've been assisting a local company actually that normally manufactures clamshell packaging, which is what your kind of strawberries and blueberries come in at the grocery store. But they have all the equipment and they have all the material to do this kind of fabrication in a big way. So that's one project we've been working on, and I've got kind of prototypes of headbands and face shields kind of sitting here at my desk. Basically a clear plastic enclosure that they can place over a patient when they're intubating the patient. So that's when they um, hook the patient up to a ventilator for kind of the assisted breathing. And that's really one of the most dangerous procedures in terms of generating aerosols and the droplets in terms of infecting the doctors. So if they can put a physical barrier between them and the patient that doesn't interfere with them actually intubating the patient, that's really kind of like a frontline way of protecting the doctors. The masks that we wear in the public are more to stop us from contaminating other people, from infecting other people. But for a healthcare worker, their mask needs to really fit tightly. And if we can figure out a way to take kind of a common, widely available mask and give it those fit and seal properties of the special N95 full face respirators, then we can really give the healthcare authorities a lot of flexibility in dealing with these kind of PPE shortages. And not just in BC, but there's interest in this kind of thing all over the world. I think the biggest success that we've had has been helping this company. They're called Packrite Manufacturing, and they're out in Langley. And really, they've been doing a lot of the kind of technical work. When I first started looking at the face shields, in the project lab, we were saying, well, how can we come up with a design that can be mass manufactured? And so we did that very quickly, and we started laser cutting these. But then very soon, we were introduced to this company that has the high-speed die cutting punch presses. And then we really just shifted from saying, okay, instead of us doing the engineering and the design, let's get the Health Canada application in, and let's start talking to the PHSA, and let's round up the network of doctors we've been working with and nurses, and make sure that it fits and it provides the coverage. And so we did that very rapidly, and now that company is making about 5,000 of these per day, which is a significant number when you think about how many could be needed. So I think there's going to be a lot of longer term projects that start to come together, where there will be a lot of innovation required on medical and dental procedures and stuff like that. And there's a lot of opportunities for engineers to contribute there, working with partners in obviously medicine and nursing. We're working with researchers in the School of Population and Public Health at UBC who can speak to things like fit testing and occupational hygiene. So I think there's going to be a lot of stuff coming up, and there's going to be a lot of problems to tackle. And it's hard to predict what they are right now, but already we need support for just even the rapid prototyping. So for example, we have great resources at UBC, like the Hatch Makerspace is an incredibly equipped facility to rapidly prototype some of these things. But now we need to make 40 or 50 devices so that we can do a fit test across a large number of people and make sure that we're not testing in a way that is going to introduce bias, so that something works only for me. We need to make it work for all healthcare workers. And that's where we need funding to say, well, now we need to make 50 of these every day and iterate the design at that scale. So there's going to be a lot of diverse needs that come up, but there's some really interesting problems that need to be solved, and there's a great opportunity for leadership.